Well, thanks for joining us here today. I'm Erika G. from Wright, Lindsey, and Jennings. We have been the attorneys for Responsible Growth Arkansas on the ballot initiative, and will continue to be. And I'm happy to be here with our chair today, Mr. Eddie Armstrong. Eddie, would you like to tell us a little bit about yourself?
I'll be brief, but thanks. It's not about me. Hi, I'm Eddie Armstrong, chairman of Responsible Growth Arkansas. My vice chairman is Mr. Lance Huey, who's not here currently, former law enforcement, former head of security for the Arkansas Lottery, and comes with a wealth of experience. And I represent a ballot question committee that was orchestrated and developed by many industry leaders and stakeholders that were interested in the opportunity for the expansion of medical marijuana in our state. How I got here, I guess maybe that's important to some. Number one, my family for a number of years have been impacted by opioids. And while serving in the legislature as House Minority Leader, this pandemic or epidemic and the opioid crisis started to tick up. And I started to really pay a close look at maybe how we could offset that. I eventually transitioned into the urine drug testing space and ran a toxicology lab for a few years after I left the legislature. And then from there, we have a cooling off period, as my friend Mr. Pascal knows, that you can't lobby or try to influence your former colleagues. So I took my talents to Chicago. And while in Chicago, they were on the front lines of legalizing recreational cannabis for Illinois through the legislature. And I paid very close attention to how that was done and implemented. And when time was right, unfortunately, we had the COVID pandemic. We brought our talents back home, and I was proud to go to work for Natural State Medicinal Cultivation as an intern, where I got my teeth kicked in on learning how to pot and plant and package and, all of these things that you wouldn't believe go into actually cultivating and making certain you're compliant with BioTrax and all of the systems that are in place, legally compliant. But I got a chance to see that firsthand, and then from there, Erika, jumped into government relations, which is natural for me, and was happy to partner with ACIA and the other lobbyists in the industry. And we were very effective in beating back legislation that could have easily impacted the growth of the industry and passing some really good legislation that was helpful for the industry. So I'm excited about where we're hopefully going. But that's a little bit about me.
Yeah, well, you've bringing a lot of experience to the role that you're playing now as the chair of Responsible Growth Arkansas. Can you give us a summary? I think a lot of people are probably familiar with what this ballot initiative looks like, but for those who aren't, can you give us a summary of the top line details of what this initiative is about?
Sure. And just for everybody out there, AAUCA. Let's plug that into our brains. AAUCA, Arkansas Adult Use Cannabis Amendment. I mean, the question's been asked. Shout out to Matt Devin for putting me on the spot yesterday. But if you remember that as you go towards November the 8th, and hopefully as we get the signatures, I think the thing I want to point out, Erika, is that it's true that the medical marijuana industry has gained a lot of great success, and we should be proud of that as an industry. I think we're at a critical mass time where, if indeed this is passed and brought to the people, the opportunities for what we've seen with medical marijuana and the taxes that are derived from this to be able to provide resources for law enforcement, healthcare research, keeping it out of the hands of children are real true value adds to our state. And in addition to improving our economy with the new revenues that the state's now seeing from this. I don't want to get into all the details. There are many posters out there, but as you walk through this expo over the weekend, you can learn more about why we chose to focus on a responsible way of reforming our marijuana laws in the state of Arkansas, and not just, trying to amend the Constitution, which is a very heavy lift. As many do not know, we're talking about amending the state's Constitution. So being able to expand the number of cultivators, expand the number of dispensaries in a responsible, meaningful way while keeping it out of the hands of children and being conscious about the stakeholders that were already benefited from it is something that I think the industry stakeholders took a broad and good look at first. So those are some of the real top line points that I want to highlight, that we've got to be proud about that, and hopefully we can usher in the rest the same way.
Yeah, so I want to pick up on one comment that you made, that a lot of people may not be aware of, that this is a ballot initiative. This is not a piece of legislation that's going before the General Assembly. What can you tell us about what the key aspects are about a ballot initiative and why you chose to do this and not pursue another way?
Well, number one, we chose to do it because we incorporated the stakeholders that were already impacted by it. Alcohol Beverage Commission, the AG's office, current governor, the industry stakeholders, ACIA. But Steve Lancaster, who's our attorney, is the expert here, and I've just learned a great deal. I wasn't a ballot initiative guy, first to say that, didn't know anything about it, but to get 89,151 signatures, Steve, hearing that about, that's a heavy lift. And to get those signatures all confirmed and processed, and then once you've gone through the signature process, which is a very expensive lift in itself, the next proportion of that after being approved by the Secretary of State would be hopefully to get it on the actual ballot, and then hopefully to galvanize voters to actually go to the polls and vote for it. So we've got many steps to take. And I think the industry, looking at access as being one of the key barriers, they wanted to reform this and approach it in a way that could expand the industry responsibly. Number one, we're not Oklahoma. We're not our border states. We wanted to do something that was very responsible. So when you look at the number of cultivators we're going to, and the 120 dispensaries that we're going to, those are pieces of the amendment that really stick out. There have been many questions asked about social equity. And when amending the Constitution, this is a broad stroke approach at trying to package as much as you can in there that really matters, and then hopefully working over a period of time with lawmakers, which we have done and continue to talk to, on how we can approach things like social equity. That doesn't fall on deaf ears on me or those in the industry. And then economic development, creating this new economy for the state of Arkansas is vitally important. And many don't know this. We rank, number 5 in the country with cancer-related deaths. That's a big deal. Number 2 in the country as it relates to number of deaths we have here versus heart attacks. And if we could be indeed a part of bringing resources to cancer research that are providing cancer care, or not allowing our citizens to maybe have to go to Mayo Clinic or to our border states, would be a huge win for the state, I think.
So let's go ahead and talk about the elephant in the room. There are at least 2 other ballot initiatives on the same or similar topics that would legalize adult use in one way or another. How is this initiative different and similar to the other 2 that are out there?
The first difference was, I think, the industry. This is a year and a half in the making. Really wanted to pay attention to who was impacted. So they went to state legislators, county, local stakeholders to find out what they may be apprehensive about, and try to bring something to the table with you all's help in crafting it that really spoke to things that they were concerned with. Children's safety, health care, true reform for decriminalization. What does that look like? Can we do it now? No knock against the other 2 amendments, but ours is the only one that's really focused on government leaders and stakeholders being a part of it from its inception. The home grow issue, that's a huge elephant in the room. Look no further than Oklahoma again, but we want to keep our neighborhoods safe. We want to keep this out of the hands of children. And I think opening up Pandora's box to be able to allow us to grow this in our homes may bring about more problems and opportunities for law enforcement that we don't want to see. Denver, they used to do raids all the time, and you would hate to see any form of that or in these conditions now with no-knock warrants. You just never know. So I think what the industry did there to differentiate ourselves by going to stakeholders first and then unpacking this in a way that really looked at these other issues that we knew we could not maybe address in the actual language of the ballot, but be able to focus on working with those same state legislators and stakeholders to hopefully bring this about in the future. I mean, the NCIA funds are huge. Oklahoma, as you know, raised $400 million to get this done there. We have no NCIA accreditation thus far, but the monies that have been generated are moving us in that right direction. And it took them 15 years to get there. So hopefully we'll see some real benefits to the people that truly need it the most. I know a lot of people out there, not a lot, the naysayers, some say that this truly isn't patient driven. It doesn't help the people that need it the most. Well, you tell me who needs it the most when we're leading in cancer deaths, if we can find a way to actually support them through this initiative and this effort.
So let's unpack that a little bit, because I think maybe we need to tell them about that acronym. So you're talking about UAMS. You're talking about the
National Cancer Institute accreditation.
So a portion of the tax money in this initiative is directed specifically to UAMS.
Correct. The privilege tax.
And that is what I think you're referring to support the Cancer Institute designation. Could you talk a little bit more about that, please?
Well, yeah, the Cancer Institute designation is something that, in our region, we don't have. Arkansas, Mississippi, and Alabama are the three states that lack this. Oklahoma now has it. But for just layman's terms, think about your grandparents, or I'm sure who knows someone that's died of cancer or has a family member that's been impacted by cancer in their life. Many people in this room. We don't have to send them away from the state for their care now. This could have a trickle effect on not just general cancer, but heart cancer in the heart hospital. And so this accreditation would do tons of good for that population of our state that truly needs it. They then have a better, cancer care facility right here in their own backyard here in Little Rock. Our rural towns don't have to worry about leaving the state. And I think that that's really important that we highlight. We can't do a one-size-fit-all. This wasn't intended to make everybody happy. I think from the business leaders' perspective, those that are the investors in this looked at the opportunity to take advantage of how do we expand this in a meaningful way. And this is their approach. And, maybe we make some people upset along the way, but I think that there's a lot of good to be done for our state with this new economy and the effects of what's going to happen with UAMS in the future. Well,
they have a saying in the legal world that, you have a good settlement when no one's completely happy. and I think, when you take a big tent approach, you have somewhat of a similar scenario. I don't think anyone involved is getting everything that they want.
Absolutely.
Because there's an effort to address so many different groups and so many different stakeholders and the things that are important to them. Would you agree?
I do agree. And, it's not a one-size-fit-all approach. But that's okay. Being a former lawmaker and thinking back to my days when the Affordable Care Act, now Arkansas Works, was the hot topic. And what it's done for over 200,000 Arkansans that are able to now have healthcare access. We estimated that there would be maybe 20,000 patients on the medical marijuana roll when its inception, and we're now at 80,000. So you're looking at hopefully another benefit there that we just have a lot of work to do. We don't take this lightly. I think the other two amendments, one of the things that I can say that's different about ours than theirs is that we're the one that's well funded, it's industry backed and supported, and we plan to make it to the ballot. No slight to anyone else. We would like for them to hopefully join or sign our petitions or get out there and become advocates and find ways that we can work together.
Yeah, you mentioned 89,000 and some change signatures. Well, you've got to get a lot more than that to make sure you have enough valid ones. Yeah. Yeah. So people have probably seen a petition gathering process before, but probably don't have a very good sense of what is actually involved in making that happen, to get the right number of signatures and to get it onto the ballot. So when you talk about this one being well funded, is that part of what you're referring to there?
That is exactly, this, I chair and will be a part of what will be hopefully the evolution of the public facing campaign, internet, digital, TV, pamphlets encouraging you to go vote. But the first tranche of work and the majority of the resources that were raised for this are focused on our legal support and this actual petition step. And if we do not indeed get this done in this route this time around, we may not be able to ever do this in the future because of the proposed referendum for 60%. And that was taken into consideration as well.
Because the laws continually make it more difficult.
Correct.
To get on the ballot.
And I want to highlight the fact that I lost my train of thought, but it's going to come back to me.
All right, I've got another elephant if you want to jump over to that.
I got it. This petition is not a vote. You know, a lot of people that may be confused about signing petitions, sign them all. If somebody approaches you signing one petition versus another petition, sign them all. We're going to do the work with our petition company to make certain we get the adequate amount of appropriate signatures. This is just to get it on the ballot, and we have to meet that threshold first. If we do not get the adequate amount of signatures and those signatures are approved, we do not make it to the ballot. Once we make it to the ballot, we then indeed would encourage people to go to the polls and vote November the 8th. But our first piece of legwork is from now until May, just to get through all of the tranches of a heavy lift that the industry is not taking lightly. And they, you know, I'm proud of them. The dispensaries, the cultivators, the bank, the labs are all at the table considering how they can invest and be engaged in this said movement.
And try to, again, big tent, bring everybody together and move this forward.
As many as we possibly can.
Yeah. Yeah. Well, okay. I'm going to the elephant now. Are you ready? There's been a lot of discussion about social equity. Does this ballot initiative include any provisions designed to address social equity? And if not, why not?
Great question. It does not. And as I mentioned earlier, going to a place like Chicago, as you might imagine, social equity, big corporate, had a lot of hiccups there. And I think if you look across the country, we've seen what has and has not worked and what still is yet to be seen if it does work with social equity. And so when trying to develop a constitutional amendment and placing social equity components in there, we stand the chance for legal challenges because we haven't truly unpacked social equity. It does not fall light on me as an individual, number one, with family impacted by marijuana, friends impacted by marijuana, communities devastated by it in the 90s when I grew up here in 1993, that there must be something done. However, because it's not addressed in this actual language now, the work that has been done with the industry leaders, myself, ACIA, to begin conversations with legislators and lawmakers to really start to think through what would Arkansas's social equity and restorative justice package actually look like. And that's going to take a lot of work. If indeed we put it in the actual amendment, you know, I've heard other opponents say they have no faith in the legislature. I can understand why. But the work that I've seen done and the proof in how we actually make the sausage bill is the work that must be done beyond the hour of actually getting it into this amendment and getting it passed by the people. So, you know, that wasn't not taken into consideration as well. Do we do it or do we not? And if we don't do it, then how do we get there? And I think that work is currently still being done, and you know, one step at a time. But it's not because the state didn't want to do it and doesn't believe in it. We're developing a new economy. We're helping the people that need it, I think, the most at this point with those cancer patients. And we have a chance to really transform communities and maybe impact to future generational wealth in the state when we start to chip away at how we unpack social equity in a meaningful way and not promising or giving a false rubber stamp in this amendment that then we would be faced with challenges. And I don't want to have to go through that.
Yeah, one of the things that has been interesting to me about being involved in this industry is that, you know, Arkansas is really on the tail end of this nationwide. And so we get to look at what other states have done and
Correct.
things that they did not do well. You know, people thought this is going to work great, and then it really just fell apart in practice. And so I think that makes a lot of sense.
A glowing example, Chicago, South Side. I was there. I lived it. You had big corporations providing opportunities for new groups to apply for licenses with the hopes and promises that minority communities or those that were impacted the most by the war on drugs would receive new licenses. And that was in their laws. When it was time to award those licenses, loved my mom, loved women, but the majority of the licenses only went to women and veterans. And that left a whole section of people that were really anticipating this in the cold, and a lot of money was spent up against the pandemic. So why go through those types of dilemmas when we can truly walk hand in hand with whomever our next governor is? If they're focused on economic development and jobs, this industry continues to grow. It's an essential service. We're providing more jobs to the state. We're growing the economy, and I think that we've got a good shot here to work with the new administration, whomever that may be, to unpack this.
So let's talk a little bit. I think this is my last elephant on.
I didn't know there were that many here.
Yeah. Why aren't there? Why doesn't this ballot initiative include provisions for more big cultivators?
Well, that was a question I had, and I'm very intimately engaged with one of the big cultivators, family-wise and work-wise. But when you think about our big cultivators and the fact that you're able to, with what we have in the 8 cultivators right now in the state, they would be able to supply all of the dispensaries and all the customers in the state as it currently stands. They did not, the stakeholders, the industry did not want to take that approach. They looked at a meaningful way that we could usher in craft grows, which mean lower yields, better quality, potentially higher prices. Think of it no different than your craft beer companies, your craft breweries. You're able to provide a product in a rec market to more customers. And that was something that I think the industry leaders looked at. It wasn't we just want to exist alone. There were lots of conversations about how do we properly and responsibly expand this for access to current medical patients and future rec patients. And so that's where we address the whole craft grow tier 2 grower proportion of this.
That will be able to be more specialized.
Absolutely. You get more specialized products. If you've not, and you have an opportunity to see any of the major cultivation facilities out here, their yields are huge. Not to say that the quality's bad, but it's going to be a much different ball game when you get to smaller yields, more craft, infused products, craft flower that, we can now see with better trichomes and better quality versus some of the nugs you see now. And speaking of the nugs, we've got a lot of work to do in this campaign to destigmatize this. This is Arkansas. I'm a Baptist boy, and my mom fell over twice when she knew that I was doing this work. But she's definitely come around. My 92-year-old grandmother with arthritis in her hands uses our hand creams. Things outside of smoke inhalation we have to begin to have conversations on. I see one of my colleagues in the back of the room, and we were talking pot brownies the other day. Removing some of this whole notion that it's just about cooking it and getting high. This is an actual functioning drug, ladies and gentlemen. And some places may prescribe you hydrocodone. We may offer you a salve or a tincture cream for your back pains or 2 Tylenol. And that's something that's really important to note, that it's no longer just about smoking dope. This is a real help to our population and to our people. And that message has to be carried out there to make people more comfortable.
I think certainly having the chair of this be a former state legislator gives us good indication of the way the state has moved since medical was first passed.
It depends on how you look at legislators. I mean, it's not everybody's cup of tea to be an elected official, but it's where the work is done. And that's exactly why I got into elected office. I look at people, problems, solutions, and opportunities. And I think we had some problems. We've got a population of people that need some support. I think the industry is bringing forth great opportunities for solutions and expansion and growth in the way that we're approaching AAUCA. All right.
Now it just rolls off the tongue, doesn't it?
All right.
All right. Well, I appreciate you taking the time to talk
Absolutely.
today. Appreciate all of you for joining us. I think we're about to get ushered off the stage, so we'll wrap this up.
Yeah.
Yeah.
Thank you. Thank you very much for your time.